Okay, so yes, I'm really excited to introduce you to the next amazing lady we have with us here in camp. She is truly an inspiration. I wanted to give you a little bit of background as to how Jessica came into our lives. So for many years, we had wanted to do some work with domestic dogs in the area because the issue of diseases is spreading and it's becoming more and more of a problem here. We didn't really have much capacity, but we said, let's just do what we can do. And maybe a couple of times a year, let's get a bunch of vets, private vets who donate their time from Nairobi, come and vaccinate dogs against these deadly diseases, rabies and canine distemper. So we did that in 2019 and 2020. For 2 years, we did as many vaccinations as we could. And this was under a program that we had called Kura's Pride. We have called Kura's Pride. Kura is our camp dog who's actually just in front of us. And Kura is a dog that came from down the road. He's from the village. And when he found us in our camp, he was lost and, really just lost and very stressed out. But his whole life changed when he came to our camp because we took care of him. And so he really was the inspiration for this program, the Kura's Pride program, where we were trying to understand, was it possible for us to do more for domestic dogs and work with the domestic dog owners to encourage responsible dog ownership? Because there's a direct connection between looking after dogs and having healthy dogs and wildlife conservation. And Jess is going to talk about that. So we did this for a couple of years, but we wanted to do more. These one-off vaccination campaigns were not enough. And we wanted to really have a much more sustainable long-term program. And so last year we decided to really step up our efforts and have a permanent veterinary unit. And that is where Jess comes in. So Jess has been working with us for about 3 or 4 months, and she's truly incredible. And I'm going to hand over to her. She's going to tell you her story about her truly tremendous high impact work in this landscape. So over to Jess.
Hi, Joe. Are you able to hear me well?
You won't be able to hear him. Just keep going.
Okay. So I'm really excited to be here today and to share a bit about the work that we're doing, which is really enjoyable and fulfilling, especially towards conservation and the community. And so in this picture, you see me holding a puppy and a really cute kitten. But my love actually started out with snakes. And I thought I would be in that line of snakes. So looking back, growing up, I remember my brother always wanted to be a pilot, and my sister, God bless her heart, she wanted to start up a bakery and a morgue. And I was the one who's always been undecided. And I didn't know what I wanted to do with my life. And so moving along, I always wanted to say, maybe I would be a vet, maybe I would, be an engineer, maybe I would be this and that, but I wasn't really sure until moving forward with time. And my parents come from a background, as Montelli is, a rural pastoralist community. And I didn't know about being a veterinarian, unfortunately. And that perception, being a veterinarian, was for men. And so when I was enrolled into vet school, I remember being so scared and going to my mother and asking her, do I change this? Do I go to another course? And she told me, no, do this. You're going to do this, so go for it. And so I went to vet school, and I was so excited because I didn't know what I wanted to do. But when I got this, I said, this is what I'm going to do with all my heart. And so I studied through vet school, asking myself, so what is in this course that I could do, that I could give back to my community? And so going with that, through vet school, I went to a lot of courses. I did public health. I did dogs and cats in small animal clinics. And I did all that until I was introduced to public health and the concept of One Health. And I was blown away thinking about how there's something I could do that could help the animals, that could also help the wildlife, that could also help the environment, that could also help the community. And so I started asking myself, maybe this could be what I wanted to do. And so I continued going on until I finished vet school. And after I finished vet school, I started volunteering for the vaccination campaigns. And that's how I came to Ewaso Lions and other conservancies within this rural pastoralist community in northern Kenya. And so through volunteering, And I saw this beautiful landscape and the beautiful people in this area who have already started conservation long before, we started having organized national reserve and national parks. They have coexisted with wildlife, and they have lived with them, with the dogs, with the cats, with the livestock, with the wildlife. And I was so impressed that they live together in harmony. And I asked myself, wow, okay, One Health could come into this. Diseases, they're sharing the same water points, they're sharing the same pastures, they're walking through the same landscape. And I started saying, you know what, I actually love this more, this could be it. And so I started volunteering, coming. I was still living in Nairobi. I was working with snakes at that point because I knew snake bite is a problem within rural pastoralist communities, and I wanted to learn as much as possible about it. And that's how I was introduced to more of community work and started volunteering through northern Kenya. And so when I started volunteering in these conservancies, coming to Ewaso Lions, going to the neighboring conservancies, I really loved it. And so when I finished vet school and I wanted to do my internship, I picked up my phone, I used my Google Maps, and I moved to a town in northern Kenya, knew no one. And my parents were scared. They were wondering, who do you know there? Why are you going there? And I told them, you know what, this could be my path. And this is what I wanted to do. Let me try. What could be the worst that could happen? So I went. I had a bit of savings. I went to looked for a house. I came for a weekend, looked for a house, went back to Nairobi in a day, came back, cleaned my house, moved in the same day. I came with all the groceries so that I didn't have to get lost in town. And that is how I started working in a town in northern Kenya. And from then, I was always working within communities, vaccinating dogs and cats, moving around with other wildlife veterinarians in this area, and finding my passion and my love. And every day, knowing for sure this is what I wanted to do. This is what I want to do. Until this point, I am so convinced that this is what I wanted to do. And that's just a bit about myself. And that is how I am here working with Ewaso Lions within this community, working side with Montelli and other amazing people doing amazing work. So just a bit about the community here. As Montelli said, they are a pastoralist community. So they really value livestock. Livestock is their livelihood. So they live with all dogs, cats, donkeys, camels, all the domestic animals. They live sideways and along with them. And they share water points with other wildlife, lions, elephants. This is the Ewaso Nyiro River, as Montelli showed you. This is where all the wildlife, all the domestic animals, all the people come to take their water. So they really live closely to one another. And part of the community who are very important is dogs and cats. It's amazing how one man, an old man we met a few days ago, was seeing the work that we are doing. And he said that without having dogs in your homestead, it's like you're blind. They see it as you're blind. It's like you are not a full house. And so they really value their dogs because the dogs play a very important role in guarding the livestock when they're going out to herd, at night when they're sleeping, because there's wildlife, there's hyenas, there's lions. So the dogs are the ones who guard their domestic animals as they go out herding and as they're staying at home. And cats also play a very important role. And this lady was with us. We were giving a dog a drip who was sick, who is now fine. And she came with her kitten and was sitting with us, playing with her kitten and looking at the work that we are doing, and was so happy that finally there's someone who's able to give them veterinary services to their dogs and cats. And so moving back, Montelli has talked about the challenges that is facing conservation. And the environmental part of it is that there's climate change. There's no pasture. There's no water with the drought that is happening. But also part of the challenges that wildlife face and conservation is facing, conservation for lions, is the other aspect of diseases. And there are many diseases that cross through wildlife and come to domestic animals and move from domestic animals to the wildlife. And so that is why I'm here, to help bridge that gap so that we have One Health, so that if the domestic dogs are healthy, the wildlife will be healthy. If the environment is healthy, we'll also all be healthy. And so we are teaching that to the community. And just emphasizing about diseases, one of the diseases that passes through domestic animals to wildlife is rabies. And this is a picture in Tanzania of a rabid dog going to attack a lion. And yeah, so this is one of the diseases. Among them is also distemper, which I'll show you a bit at the end. So these are among the health challenges that the animals face, the domestic animals and the wildlife. And so that is why we have the Community Animal Health Initiative within the Ewaso Lions program. So basically, it's just a mobile vet unit, which I'll talk about a bit more. But we are not working alone. We are working together as a team, because through collaboration and partnership, we're able to achieve much more in conservation. And so we are working in partnership with Animal Care Center. We're working in partnership with the county government of Samburu, where we are. We're working in partnership with the Foundation for International AIDS to Animals. We're also working in partnership with Vet in Wild to ensure that we have veterinary facilities here, supplies and never run out. And we are based at Ewaso Lions, where we are right now, working within Westgate Conservancy, where Ewaso Lions works as well. And so this is our team that we work every day with. We have, at the bottom is Solomon Lenasalia, who we work every day with. So we are working together every day. In the morning, I drive the car. He helps me with preparing the dogs and getting supplies. He's tall, so that helps me because I'm very short in, doing everything that we need. We're also working with veterinarians in Kenya. We have Dr. Stephen Chege and Dr. Mosin Likoniwala who are helping us. And we also have the amazing Dr. Shivani, who's always here in camp, helping me whenever I have any challenges within our vet unit. And so our vet unit comes in form of a car. So we have a car with a tank at the top. We have an examination table on the side. We have cabinets at the back. And so because the communities are very far off, and even the homesteads are far from each other, so we move around, going to them, reaching the dogs and the cats when they're sick, or when we want to do neutering, or when we want to do any other activity. So our unit is a mobile vet unit. So this is the car, but we also have an office here at Ewaso Lions in Samburu, where we keep our supplies as well. And so other than going to treat the dogs and the cats there, they often stop us on the road because they know this is the dog and the cat car. They literally call us the people of dogs and cats, and we have owned it and we love it and we're very proud of it that we're able to help in that sense. So many times children stop us along the road, like this child. She was just from school and she brought us her cat and she was saying, vaccinate my cat because I know my cat can get rabies and I love my cat. I don't want my cat to have rabies. And it was very beautiful to see that. And so the vet unit has four main functions. So the first one is treatment of dogs and cats, treatment, vaccination, and neutering of the dogs and cats within this community. Our second role is emergency response. So when we have domestic animals that belong to the community that have been bitten by wildlife, either lions or hyenas or any other wildlife that has attacked domestic animals, so we go and try to mitigate that by treating the animals so that they get better. Our fourth objective is education. So we train the communities in partnership with Mama Simba, teaching the women, in partnership with other programs within Ewaso Lions, teaching them on responsible animal ownership, on One Health, of how it all interconnects, our health and the health of dogs interconnects with wildlife, and teaching them of these diseases, that rabies and distemper, that you need to vaccinate your dogs and cats so that they don't get it. And when we have healthy dogs, we'll have healthy wildlife as well. And so we have education. Our last function is on disease surveillance. So we always try and see if there's any disease that could potentially go to the wildlife within this ecosystem and within this landscape. And so this is me treating a camel that was bitten by a lion. And this was on my second day in camp. I had not even unpacked my clothes when I had just arrived last day in October. And so between October and at this point, we've done 87 responses, which is amazing. And we are glad that we've been able to mitigate that conflict by treating the animals so that there's no retaliatory killing within wildlife. And so this is us treating a camel that had been bitten by a lion. This homestead, they had 4 camels bitten by lions. A good thing it wasn't severe, and the camels are actually fine right now. We met them a couple of days ago and they're fine. part of emergency response is treating domestic animals that have been bitten by rabid dogs. So unfortunately, rabies is endemic in Kenya. And so often we have stray dogs that are rabid moving across the landscape because they now have no owner. They're just moving across the landscape and biting other domestic animals or other dogs or even people. And so this man, he's called Letuno, had his donkey, his camel bitten by a rabid dog, and he lost 2 of them, which is so unfortunate because a camel is of high value and it's very pricey, very expensive, and it supplies milk to the family when there's drought, like at this point where we are. So we fortunately were able to go and give post-exposure to the other camels, and they were well after the vaccination. And so we also respond to bites, rabid bites, as part of emergency response. So other than the emergency response, we also treat dogs and cats. We vaccinate them against diseases like rabies and distemper. And we also do neutering to control population so that we don't have a high proportion of stray dogs. And this is a dog that I found at a dispensary. I was sick. I was going to a clinic, and I found this dog right in the middle of the entrance to the dispensary. And I asked the people, alas, so who treats this dog now that you've gone to get medical services? And they all laughed and they said, oh, now that you're here, we are glad that our dogs can have veterinary services, which was really good to hear. And so we, so far between October and January, we've done 37 clinical treatments. So these are active clinical diseases within dogs and cats. And these puppies, the first time we saw them, we actually stopped on the road, and the kids came and told us, you have to come and see these puppies. They are not well, they are sick, and we really love them. And so we left our car because it's far. We had to trek. We went there. We treated them. They were very severe, and we told the owners, we don't know whether they'll be okay, but we will do our best. And fast forward, beginning of the year, when we went to see them, they were healthy and happy and strong and bigger, and the owners were so happy. They even brought more puppies from kilometers away, saying, we have a doctor, this puppy will be fine. And this lady handed over the puppy to me and said, take this puppy, vaccinate it, do all that you need to do to it so that it remains healthy, which was really good to hear. And so this puppy is eventually even made away with Solomon's shoe. So eventually he had to issue vaccination cards without a shoe, which was really funny, but we were glad they're healthy and strong enough to do that. So that's clinical treatments for us. We also do vaccination because prevention is better than cure. And so we vaccinate against rabies and distemper. And this is a very unique dog who's called Longiron. And this was our previous vaccination campaign. And like other dogs, whenever they would see me, they would bolt and they would know there's a doctor coming for me. But Longiron just sat there and just waited for me to give him his vaccination, which was very unique and very amazing. And so from him, we're trying to teach the community on responsible animal ownership, on how to show your dog affection so that they're not scared. And so we are loving that. So this is vaccination for the dogs and cats. We also do neutering, as I said before, to control population so that we don't have a high proportion of stray dogs and cats. And so far between October and now, we've done 101 neutering, castration, and spays. And so this is the first time we were doing castration, and the owners were very amazed. They had never seen a dog going under anesthesia, and so they all sat down waiting to see, so will this dog wake up? Will this dog be fine? And so this is the first dog that we ever castrated. He's called Mwangi. And he saw us. We were going to do other veterinary work within where he lives, and he came bolting to us and wondering, who's this dog? And we finally recognized him. He's the first dog that we ever castrated, and the owners were happy, and everyone was now saying, yes, we've seen it. We've seen the dog is fine. The dog is healthy. The dog is no longer going to stray for months, and we don't know where he is. And everyone is now saying, okay, yes, this is a good thing to do so that we're able to have healthier dogs and less population of stray dogs. We also do a lot of education. We partner with Montelli and other programs within Ewaso Lions to educate them. As we're talking about conservation, we're also talking about responsible animal ownership. We're also talking about diseases that spread from wildlife to domestic animals and domestic animals to wildlife. And on the left is us showing a film to the women within the Sasab community, talking about responsible animal ownership. On the right, we have Solomon having a poster on distemper and explaining how canine distemper spreads. How do you know that your dog has distemper? What do you do to prevent it, which is vaccination? And so the communities are becoming more aware on what to do. We always have amazing good days and amazing stories to tell, but unfortunately, that's not always the case. We also have really hard and sad moments as we're working within this community. And so currently, this is one of the times that we are facing canine distemper. And it is so sad. And sometimes we feel very helpless because we have so many dogs that are sick currently, and we have lost a good number of them. And we have about 40 dogs that we're currently treating, and there's only 2 of us. And it's very sad that we are losing them. And this has been a good opportunity to educate the community on the importance of vaccinating your dog, and also seeing how much of value the program is, because it's helped save a good number of dogs from the disease that is currently happening. And so this lady, I remember this was a week ago when we now had the outbreak of canine distemper starting, and this lady looked for us. She looked for us everywhere. She called camp and she said, I'm bringing my dog to you. If we don't know where the vet is. I had gone to another location to treat other dogs who had canine distemper, and we didn't have reception. And she said, I'll bring the dog, carrying my dog myself to bring him because I value my dog. And the community members were laughing and saying, hey, you're going to go and look for the vet to come and treat just one dog? And she said, yes, because this dog is of value. This dog saved one of my other dogs that had been bitten by a hyena. This dog is of value because it watches after my domestic animals. And so we came to her house, and this is Solomon on the first day, and we were in despair because there's no treatment for canine distemper, and there's only so much that we could do. So we did our best. We gave him fluids and we gave him everything that he needed, but we were also quiet, not knowing what would be the outcome. We don't know whether he would be fine. And happy enough to say, today in the morning, I just passed by their house, and the dog is healthy and fine and looking good. And it gave us so much hope that despite the ongoing disease, there's still many, and our efforts are still bearing fruits in helping the dogs that are currently sick. And so those are the tough times that we are currently facing. Despite that, there are many people within the community who give us hope. Among them is this gentleman here. He's called Francis Landrop. He's a staff at Ewaso Lions, and he is a great example of responsible animal ownership. And he is an elder within this community, and he is using his voice to tell the other elders, because they have a big say within this community, to take care of their dogs. And just to quote him, he always says, if you take care of your dog will take care of you. And that has been the motto within so many people within this community, that we need to take care of our animals because they will take care of us. If we feed our dogs and give them water and vaccinate them, we will have healthy dogs and our community will be healthy and happy. And so we're always encouraged to see them. And I have to say, they're among the healthiest and the happiest dog within this community. And we're always happy to pass by their home every day and see them looking very happy. And so that is just a bit about the work that I'm doing, and I'm really happy to be able to share it all with you all. So thank you.
All right, Jessicah, amazing job, amazing presentation. Thank you so much for sharing the work you're doing with us today. And what a program. And the first thing that kind of came to my mind was when you were sharing your story at the beginning, when you I want to go here to Northern Kenya. I don't know anybody, but I'm going, and this is what I want to do. This is what I want to take that chance. So, that's risk taking to follow your passion. I'm wondering, what advice would you give young women who want to, take a chance on a career, on following a passion?
I would say go for it. What's the worst that could happen? So I'd say go for it, because if you don't do it, you won't ever know. At least if you try, you'd say, I tried, and these are the pitfalls, and this is something I could do better. So go for it. If you don't try it, you will never know. So go for it.
All right. Awesome. Well, I love that you started with a passion for snakes as well. When I used to teach in the classroom, I'd always have a corn snake in the classroom so that students could see that snakes aren't as scary as you know, everybody makes them out to be, and they're actually really cool creatures.
Yes.
Okay,
Yes,
we've got a few questions here coming in via the chat. This first one here is from Argentina, and they're wondering, Natasha's wondering, where does the organization get support for things like the rabies vaccines and the medicines that you use out in the community?
In terms of supplies?
Yeah.
Where we get our supplies.
Yeah.
So we get our supplies in Nairobi. So Nairobi is our capital city. We are in partnership with an organization that does small animal practice. So they help us in terms of what drugs are available, what's in the market in Kenya. With the pandemic, there's a lot of drugs that are not supplies that are not coming into the country. So the small animal practice has helped us. When we're partnering with them, they bring us supplies. I always have inventories beforehand so that we know we have enough supplies for a few months before it runs out. So we're working in partnership. Partnership is always important. So we're working in partnership with them to help us have supplies within camp.
All right. Well, that mobile vet clinic is such an important idea, with everybody in the rural areas spread out. Being able to take the care right to the community is so important. Do they pay for that service, or is that something that you offer to the community?
So we offer to the community free of charge, no charges.
Amazing.
Yep.
All right. We have another question here. This is from Sylvia, and she's wondering, you know, dogs and cats, do they hunt the native wildlife? So is there anything that's done to kind of address maybe dogs and cats hunting native wildlife?
So I have not heard of that within this ecosystem, because they're domestic. So most of the communities, because they're pastoralist, they have lots of sheep and goats, and that's what they feed on, and that's what they feed their dogs as well as the food that they eat. So we have not had of that within this community, especially because they're a rural pastoralist community. So they have plenty of livestock for themselves and for their animals, especially dogs and cats.
Yeah, and it sounds like that the pets are highly valued, especially the dogs. As you mentioned, that without dogs, you're blind, right? They're so important in the community. That early warning system, that kind of protective system for the livestock. And it's like the gentleman you mentioned earlier saying that, you know, being a good dog owner leads to having good dogs. So it sounds like there's a lot of really good support. So another question here, this question, let me just double check where it's coming from. Oh, this is from Germany. And they're wondering, where does the financial support come from? Does it come from the government, from donations? Where does the support for the program come from?
So the support for the program purely comes from donor funding. So we depend on donor funding to run the program, purely on that. But we partner with the county government because they're over us. But in terms of the running costs, it's purely on donor funding.
All right. You know, what I really enjoyed was seeing the pictures out in the community of people with their pets. I think sometimes when you think of Africa, you think of out in the grassland, you think of the lions and the giraffes and the elephants, and you kind of forget about that pet aspect and how all across the world they're so important to everybody. They really do become parts of the family, and even in you know, rural communities, living amongst next to the lions and hyenas, pets are still a hugely important part of those communities. So you're doing incredible work. The program that you've built is amazing. I love the logos that you shared with, you know, the wild animals, but then kind of looking face to face with the domestic animals as well, and how the health of one is directly tied to the health of the other, and then that's directly tied to human health as well. So it's an amazing program, and it's exciting to see the buy-in that you're getting from the community. where it seems like maybe they were hesitant and doubtful at first, but it seems like you've really kind of broken down those barriers.
Yes, slowly.
Yeah. Well, one last question for you, Jessicah. What's next? Is there another program you'd like to implement? Is it you'd like to see the program grow into a larger scale? What are you hoping happens next?
For sure, I look forward to when we would expand. As I said, within the northern Kenya, it's a rural pastoralist community. So the communities move through landscape. So there's no barrier or no fence to keep the next conservancy from moving within this community. The situation that we're now seeing is community members from other conservancy are coming into this conservancy because of lack of pasture. So they have all moved here. And so what that shows is you're not able to contain only one place. You have to approach the whole landscape, so that you can't keep only these dogs healthy without reaching out to the next community where the dogs will eventually move if there's rains there. And so my hope is when we'll be able to expand and have more vet units within this area and have a bigger team to be able to reach out to them, so that we can be able to reach to other dogs and hopefully be able to reach to a good proportion of the dogs, where we'll now have a bigger proportion of the dogs healthy, and that equates to healthy wildlife.
All right. Well, one more message here in the chat. Sylvia in Brazil is just saying, what an incredible and brave life story. You're very inspiring. And, you know, I just, our hour went so fast. Our time is almost up here. Jessicah, obviously Montelli and Shivani, thank you so much for the amazing work that you're doing with Ewaso Lions through all these different community projects, really tying in the health of the community to the environment, to the animals, both domestic and wild. I want to share a couple links here. If people want to follow Ewaso Lions, there's the link you can follow on Twitter. There's the link where you can follow on Instagram. Jess, I have your Instagram link there if people want to follow along with the work you're doing, the adventures that you're having. And of course, I want to share the website here to Ewaso Lions. Please take a few moments, explore the work that's being done in Kenya. Support the work any way that you can. It's so important, so vital. And from what we saw this morning, it's working. It's changing the minds of community. People are getting excited about conservation, and we're seeing lion numbers climbing again. We're seeing healthier pets and domestic animals. Yeah, Montelli and Jessicah, you're so inspirational. Thank you so much for joining us today. And again,
thank you for having us.
A pleasure to host both of you for your first live virtual events. We're so lucky. Thank you.
Thank you as well. We're very excited.
Thank you.
All right. Thank you, Shivani. Thank you.